for the Health Department, the National Health Department, that is, today remembering nurses who died during the Covid-19 pandemic. The Deputy Health Minister, Dr. Sibongiseni Dhlomo, joins me now. Deputy Minister, good afternoon to you. We all remember how so many nurses fell ill during the pandemic from Covid-19, how so many of them really were on the front line of this pandemic. How important is it to remember those who lost their lives while caring for others during perhaps the worst health emergency in 50 years?
Good afternoon, sir, and good afternoon to your viewers. Let me just start by saying, Stephen, we were actually saying, you remember the lockdown, it had its own sort of program that assisted us to curb the spread of a virus by locking down, saying schools, teachers, other workers must remain at home. But that was not the luxury that our healthcare workers had. They were to go to hospitals, to clinics, irrespective, actually putting themselves in the line of danger, and they had no choice. And we are therefore saying this is a very unusual category of our workers who needs to have a special recognition. Yes, we want to thank the South African Nursing Council today by having this event where they enacted a wall of remembrance of all those healthcare workers, in particular nurses, who passed on during COVID. Some of them passed on assisting not only the citizens, but also now looking after some of their colleagues who also passed on, and the devastation of mental health illnesses amongst them, the families and amongst the children is really enormous. So we were then saying they did not just give their best, they gave their all for the service of our country. The selfless contribution that they made to our country that must always be remembered and be actually commended.
Also, one way to have a sort of living memorial, if you like, is to look after our current nurses better. Unfortunately, it is likely that we're going to ask them again to care for people during, if not a pandemic, people with infectious diseases, for example. Is it possible to support our current nurses better in the name of those who died?
When I talked in that event, I said maybe this should be a decisive a decisive action for really upping the game in terms of supporting our nurses. After all, they are the backbone of the health services in the whole country. We also remember, and they probably might have been picking up this statement, that there's a group of nurses who gave selflessly their lives to go and support Tanganyika, now called Tanzania, in the 1961, and we are repatriating them, some of them, their remains back into the country, who actually contributed enormously. And we are therefore saying today, the International Nurses Day this year, on the 12th of May, must probably be commemorated in a better way. This should be a start to say, have you been recognizing our nurses' contribution? Maybe not. Can we then begin to say we have to focus on that if we actually are serious about calling them the backbone of the health system in our country?
Deputy Minister, if I may, I must ask you, I don't know how aware of this you are. I know you will have been in this service today, but the Hawks have raided the businesses of what News 24 has been referring to as an ANC leader in Ekurhuleni. This is about the Tembisa Hospital. I'm sure you will be aware of Babita Deokaran, who was assassinated. We understand the Hawks are investigating 1 billion rand that was siphoned from the Tembisa Hospital. This is someone in your movement, I'm afraid, someone in the ANC who's having their properties raided in connection with all of this. What's your reaction to that? Are you surprised that this is happening?
Yeah, no, Stephen, we should be able to say as government, in fact, that issue of Tembisa is actually one of the main problems in the Department of Health in the province in terms of monies that were actually not being accounted for properly. We should be able to say, police, SIU, everybody else must do their best to investigate. Even if to investigate me. Among other things, we should be able to say, because we are actually not going to be able to like this term, ANC corrupt heads. Let us, even amongst ourselves, if they are Dr. Dhlomo corrupt, get them to be identified so that we leave this brand ANC clean of any of corruption. So we would support. There is an anti-corruption health forum established among other things, to assist us to really root out any corruption. It doesn't matter from which political party, from which quarter it comes from. If it is corruption, it is corruption, and it must be rooted out and really get those monies back into the system to assist our coffer. Look, if that could be actually found to be true, we are going to be saying, can that money come back? Yes. It will then improve the quality of life of the citizens of the country that otherwise would have been compromised if that money was not recovered.
I realize you're in national government, and this is happening in the Gauteng Health Department. Do you have powers to intervene in cases like this?
If asked, if minister is asked, and probably the minister will consult, we do have provincial leaders who take responsibilities, but there is no reason. We are a unitary country. There is no reason for minister to support. Look, you probably saw the minister. We were supporting the minister when there was an issue of Charlotte Matreke, Chris Hani, Rihama Musa right now. So the issues may be provincial, but the minister's availability and leadership there is always there and visible and supporting. So there is nothing to say, no, this is my space, the minister, deputy minister don't come into it. But of course we work collaboratively. We are one government and the unitary state. So we will support, we'll give them that leeway to actually lead, but with our support is always there to make sure we don't leave anything untoward. Because at the end of the day, health systems in the country, the president asks the ministers, so the minister should be able to account and give a report of any part of the country, including Gauteng province.
Deputy Minister, I really appreciate the time. Thank you.